What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing good. Thanks, Brian. Hey, everybody out there. Brian and I want to talk about Parkinson's disease because I've certainly seen a number of patients that have been affected by it over the years. And I know you have probably also in clinic, right, Brian?
Yes, I have.
And it's interesting about this disease because one of the most, or I should say, efficient treatments for it is really something you can do at home, and that's exercise.
Yep.
It's not even the medications that work better than the exercise. It's funny, I read an interesting it's an anecdotal story about somebody who had Parkinson's disease, had it for years, and he retrained his brain to bypass the neurological damage from the dopamine producing neurons in his brain, so that he actually had to relearn to walk, and he broke down his walking where it wasn't so stuttered, so to speak, and choppy. And he actually, using the brain's neuroplasticity, actually was able to bypass the damage so that he could walk again, and it became, again, like for most of us, second nature to do it. So it's really interesting.
Wow.
To see that. Of course, it's an anecdotal story, but we do see in the research that exercise is one of the most important things to help prevent and help in the treatment of Parkinson's disease.
Yeah, absolutely. And it goes with what you just said there, kind of that retraining of the brain. Because these people tend to get kind of small and in a flexion kind of posture, and we retrain that with exercise. I don't know if you've heard of LSVT big, Keoni.
No.
It's like a exercise protocol, and it's all based on Parkinson's, and it's basically principles of how you do the exercise. So it's supposed to be big, loud, opening movements. So when I've treated Parkinson's patients myself, we'll do like a squat where you have to open your arms at the top really wide, and we really want to count those letters. We want to count the reps really, really loudly. So we want to basically undo what Parkinson's disease is doing in our training.
Yeah, it's cool. And as we know, the brain has a tremendous capacity to reshape itself, right? And it does it on a daily basis. And we used to think that the brain, once you got to the age of 20 or so, it was basically static and couldn't change. But we know that's not true. So as long as you have life in, exactly.
I don't want to be stuck like this.
I don't want to be stuck with a cemented brain. But anyway, so that's pretty neat. And because of that, Parkinson's can really be treated in a much more efficient way. However, unfortunately, there is no known cure for Parkinson's as of yet, although I think that's going to be changing. But before we get into that, so what is it? It's a neurodegenerative disease, basically of the central nervous system. So basically, the nerves are not functioning efficiently. And the main nerves that are affected are the neurons in the brain that produce dopamine. And that's located in the midbrain in a place, or they're mostly concentrated in the midbrain in a place called the substantia nigra.
Yeah. And I can't remember, Keoni, if you look at it with someone with Parkinson's, does that substantia nigra, it's normally really, really dark, and it gets whiter with Parkinson's,
yeah,
I believe, like on
right.
imaging.
Yeah, I think you're right. Hence the name, right? Mm-hmm. So, yeah. Anyway, so what happens with the disease is they start experiencing all these weird motor symptoms, and they have dysfunctional movements and things like that. And then as the disease progresses, they get cognitive decline, and hence the stereotypical dementia type symptoms that we see, where you get memory loss and stuff like that. But it's the motor symptoms that you see first in this. And it can be, show up as a tremor. It can show up as like involuntary muscle twitches. It can show up as, just weird sensations that people feel in their muscles or skin, and they don't go away, and they progressively get worse.
Yeah.
And risk factors for the disease. Well, like most diseases, genetics does play a role in this. So family history is an issue. So if people in your family have it, you're a little bit more increased risk. Doesn't necessarily mean that you're going to get it. And then a very big one also here is this is one of the few diseases that we know is the risk is increased substantially with exposure to things like pesticides and other toxins in the environment. And for a lot of diseases, we can't really make that connection or that correlation, but here we do. So people who are spraying Roundup everywhere or are work in like a factory where a lot of volatile organic compounds are around, you can smell them, like a paint factory, a dye finishing factory, things like that. Whenever you're being exposed to stuff, it's going to increase the likelihood that this is a possibility.
So you have a correlation between these exposures and
Yeah, right. And it's a strong correlation. Other things that can risk factors are things like brain tumors, anything, inflammation of the brain, like viral encephalitis, AIDS may do it. Believe it or not, this is an interesting one, chronic constipation. There seems to be something there too. And that makes me think of, well, if you're chronically constipated, you're probably not, you're not detoxing appropriately, right? At least that aspect of your endogenous detox mechanisms isn't working. You're not eliminating properly. And, you want to eliminate waste so you can detox. Another one, which is a biggie, is repeated blows to the head, like trauma. And you get like professional fighters, football players can get are more at risk. And then another really big one, Brian, is certain medications. Like a high percentage of people with Parkinson's type symptoms, it may just be their medications.
Wow.
Believe it or not. And of these medications, so what are they? A lot of them are like antipsychotics. I'm trying to think of some common ones.
Now, with these medications, Keoni, is the person going to see, because what I learned in school is that substantia nigra, like whitening on the imaging, is like telltale proof that it is Parkinson's disease. And that's kind of how you make the diagnosis for sure. Does the medication present like Parkinson's, or is it going to kind of lead to that?
It's going to present like Parkinson's. And when you reduce the offending agent, the symptoms should get better.
Okay. So that's how you could tell kind of the severity or if it is true Parkinson's.
Right. So anyway, the medications that are a lot of the antipsychotics that are out there. And I'm trying to think of some off the top of my head. I can't think of any. I'm
not the medication guy.
Haloperidol. I mean, that's probably one. But anyway, antipsychotics or neuroleptic medications. Anything that depletes dopamine. So there are some medications out there that may deplete dopamine. There's some antiemetics. So medications that can help prevent vomiting. Some medications may do that. So there's a number of them out there, but the main ones are the neuroleptics or the antipsychotics.
Okay.
So it's important to go through that and check all those to make sure that that's not what it is, because a high percentage it could be that, like, could possibly be the medications.
Have you seen that in clinical practice, Keoni?
I have seen I've seen medications being a big part of it, or at least exacerbating the situation.
Okay.
So we talked about repeated blows to the head. Stroke is another one, right? Like any insult to the brain.
Yeah.
So how does it progress? Well, we talked about that it's typically motor symptoms, starts in the central nervous system, and it's motor symptoms. So you start seeing muscular type symptoms, right? So tremors in the hand, muscle cramping, rigidity. It's this, like rigid, movements that aren't fluid anymore.
Yep.
You may see pain throughout the body, movements that are significantly slowed. Anything that affects any muscle stuff that can affect things. So like incontinence requires, if you're incontinent, that's a sphincter muscle. Any type of muscle that does it, difficulty swallowing, those require muscles, that type of thing. Those things can really give you telltale signs of what's going on. And then as the disease progresses, you can start seeing some of the other things that may not be muscular. So you could see maybe see significant depression, anxiety, various hallucinations, general cognitive decline, and outright dementia.
Yeah, and you're going to see that as they physically decline too. So I think that plays into a lot of the mental negative aspects of it. You can also see a lot of movement with like festinating gait. I don't know if you've seen that, where basically they just start moving so fast, their legs are like, they're like falling forward, if that makes sense.
Yeah. And a lot of them kind of have that posture where they're leaning forward, and they're like, it's almost like they're moving fast trying to catch up so they don't fall down.
Yep.
Sometimes, yeah.
Yep. And then the flip side, and you mentioned this, they can basically freeze in place.
Right.
And clinically, what we do to kind of stop a freezing episode is basically just kind of elicit a step forward by just saying, step over my leg. And it kind of breaks down what you said, that anecdotal story where you break it down smaller and smaller, and they're able to complete that one step, which would, and then it kind of kicks them out of the freezing episode.
Yeah. It's like, break it down in small pieces and then string them together so that you can move again. Like that's a great way to help.
And break that block that just kind of came about.
Right. The main treatment, though, Brian, as people know, since Parkinson's is basically a depletion of dopamine, right?
Right.
The nerves no longer function, the dopamine producing nerves. So what do? We give something that will produce dopamine. So levodopa with carbidopa will help. And levodopa is a dopamine like compound that crosses the blood-brain barrier, and you usually give it with carbidopa because it will prevent levodopa from getting broken down into the peripheral body, in the peripheral nervous system. So it allows it to cross that blood-brain barrier. Wow. The problem with it is it works great initially, and then over time it no longer works as well.
Yeah. Yep. And then that would be something to consider with your exercise. So if you are exercising, you want to be on the medication while you exercise so you can get the most benefit out of your exercise. So you're not slowed or under the effects of the Parkinson's disease. You're at your optimal ability to move.
Yeah. Go ahead.
Have you seen the deep brain stimulators, Keoni? Those are freaking nuts. Someone will be like having just full-blown tremors throughout their entire body, and it's like a thing that's implanted in their brain.
Yeah.
They can turn it on, and then the tremors immediately stop.
That's part of treatment, but that's like down the line. That's like once drugs stop working, that can help.
Yeah, just super neat. It's crazy to just Google and see someone turn it off and turn it on and see.
Yeah, I've seen that. Yeah, it's pretty amazing. The other thing about the drugs there, if I'm not mistaken, you want to make sure you're not taking them with a lot of proteinaceous meals and stuff. You want to go a little bit lower protein when taking levodopa and carbidopa. Somehow I don't know the exact mechanism, but it doesn't work as effective on a high protein diet with that. Okay. So that's one simple lifestyle thing that you can do, at least, take these medications away from high protein containing meals.
Yeah. Okay.
I think it has something to do with like the protein meal is competing with the absorption of the drug or something.
Okay.
When you take it. So those are the main that's like the main pharmacological treatment for it is a levodopa, carbidopa. There are other things out there that can help. Like there's other drugs out there like the monoamine oxidase inhibitors types. Those things help keep the drug around longer. There's the catecholamine inhibitor enzymes that inhibit the breakdown of the catecholamines, which can keep dopamine around. Anything that acts like dopamine or has similar action can help. And then what you just brought up, like in extreme cases, you're talking about ablative surgery where you're just, getting rid of any of the competing neurons that are competing with the dopamine, where it's not the dopamine producing neurons, where it's not allowing you to do fluid movements or the deep brain stimulation.
Yeah, obviously super invasive.
Yeah. Oh yeah. And that's why it's one of the last things to use. Yeah,
absolutely. And I think correct me if I'm wrong, but I think the general name or the brand name for levodopa and carbidopa is Cinnamon. SI.
Yes, I think you're right. Yeah, I think you're right. Yeah, I've been out of the drug game for a while. So, but anyway, yeah, there's probably a whole host of names out there for combinations of those drugs or by themselves. Here's another interesting thing. It seems like smokers, um, which doesn't make a whole lot of sense. It makes sense when you think about it, but smoking seems to actually help prevent the onset of Parkinson's and may, in some situations, help with treatment. But it's specifically, we're talking about nicotine, so it has to do with the nicotine.
I wonder if it's okay. Okay, so nicotine specifically. So you could chew like a nicotine piece of
They've
gum.
tried that and haven't had really good results. Something about smoking it and getting the nicotine in there. However, there are nicotine is a nicotine like drug may have some therapeutic benefit. I haven't seen it a whole lot, but nicotine smokers, it seems that Parkinson's is one of the very few things that may benefit from the nicotine in cigarettes. So smoking may have a benefit. So I'm not telling people to go smoke, because if smoking does so much more damage in other ways and has so many other things, but it's interesting to think about.
I'm sorry, did you just say a cigarette a day keeps the Parkinson's away?
No, I didn't. No, I didn't, and I would never say that. But it's fascinating to me, though.
That's nuts.
That's one of the few things that may.
Well, nicotine's one of those things that just on the side I've learned is super powerful, just for your brain power, and can almost be neuroprotective from what I've seen.
That's exactly what it's doing. It's neuroprotective. Right. Absolutely, that's what's going on there. Somehow it protects the neurons from being broken down.
Just got to find a healthier way to use it.
Yeah. There's other things out there that can help, like cognitive behavioral therapy. That can help. That's a pretty non-invasive way to help. Yep. But my love is all the non-pharmacological ways that you can help.
Yeah. So
we already mentioned physical therapy. That's the big one. Like I feel like anybody with Parkinson's disease ought to be seeing a physical therapist, and then on top of that, getting into an exercise program, because honestly, it seems like any exercise helps.
Yeah. Yep. Absolutely. And there's a lot of support groups too. If you know someone, and it speaks to the depression aspect as well, where there's a lot of exercise classes. I'm forgetting that Rock Steady Boxing. That's the name of it. It's that's a national boxing club for Parkinson's disease. And it's a specific class that is at a variety of different boxing gyms that is specific to Parkinson's.
Oh, wow. That's pretty neat.
Yeah. So that's options for, and obviously a lot of these people are older, so they kind of end up living by themselves. And I think that does play a lot into the depression aspect and getting them all together. I've had the opportunity to volunteer at a few of those classes, and you just see the camaraderie, and then it pushes everyone to be a little bit more active and be bigger, which is what we want in Parkinson's disease. Because like you mentioned, they get that stooped posture. Yeah. Yeah. And we already mentioned the other lifestyle thing they can do is like protein meal distribution, eating it away from when you're dosing with the L-Dopa. Mm-hmm. But there are tons of natural therapeutics that seem to help, or at least in theory can help. And a lot of it just has to do with going back to what you said, the neuroprotection aspect of it all. All right. So, one thing we see is patients with Parkinson's are a little bit deficient in CoQ10. They seem to be. And supplementation may help slow down the progression. And it makes sense because anytime you can enhance the mitochondria of any cells, the body's going to work more efficiently. And you can think about CoQ10 as being part of that electron transport chain within the mitochondria that produces ATP and then enhances, cellular efficiency. And so anytime you do that, you're going to enhance the body's movement efficiency. You're just generally going to feel better. But there's some research that shows that it has a neuroprotective effect. CoQ10, wow. Very safe thing to take. It's not going to have any negative side effects at all. And is it good to take with these medications, Keoni?
Actually, as a general rule, I really like to take all nutraceuticals away from pharmaceutical meds because I just don't know what's out there as far as like inhibiting the absorption of the med, that type of thing. So I think it's a good rule of thumb, unless we hear otherwise, like as far as maybe a vitamin enhancing the absorption and enhancing the efficiency of a drug. But I think it's just good to take them away from each other, at least by an hour or so.
Awesome. Yeah, I know you said that before too.
Yeah. And I can't imagine CoQ10 causing a problem, but it's just a good idea to do that. We've talked about this nutraceutical before. What about creatine, right? We think about that for building muscle mass. It has an ergogenic effect and stuff, but some studies indicate it may slow down the progression. Very simple thing to take. Helps with building muscle, has an ergogenic effect, which is interesting that it may help with movement in a sense. A more stereotypical thing that helps with, you think about it as a brain food, are the omega-3 fatty acids. So we know that omega-3s decrease in level within the cell membrane as we age. And therefore, guess what? Cell-to-cell communication doesn't work as well. And when cell-to-cell communication doesn't work as well, you're not going to be as efficient with movement.
Yeah.
I actually forgot to mention another thing, that we talked about nicotine as lifestyle thing, but drinking coffee also may have some effect also. It seems to reduce the risk of developing Parkinson's. There's some studies that indicate that.
Yeah, isn't there similar information out there about it regarding that with dementia as well? Didn't we talk about that?
Yeah, there is. So coffee extracts, way back, I don't know, it was a fad of like a couple of years ago, maybe it's 4 or 5 years ago, but green coffee bean extract, right? That may have some benefit here. It certainly doesn't seem to have a whole lot of benefit for weight loss as it was being marketed for that, but that may have some benefit here. And I just think coffee is being a powerhouse for antioxidants, great neuroprotective. It's not going to hurt, right? I mean, so coffee can help. I would just mention organic coffee is going to be the way to go, because coffee is one of the most highly sprayed crops and that type of thing. So you definitely want to use organic coffee.
Yeah, reduce your exposure, like you mentioned up front.
You definitely want to reduce your exposure. You don't want to add more to your total load. Yeah. B vitamins are huge. They help with that whole metabolic pathway of going from tryptophan to serotonin to dopamine, that type of thing. Those B vitamins help those pathways go. And at the end of those biochemical reactions, dopamine is there. So you want to enhance that as much as you can. So B vitamins are huge for that, especially B6. So taking a good B vitamin supplement is huge. And then as we get older, we also know that vitamin D, people don't really check that a whole lot. Most people are deficient in it. Vitamin D may also protect against Parkinson's and slow down things. And then one of my favorite is curcumin. It's
second only to magnesium.
Second only to magnesium, right? But curcumin is huge. Turmeric, curcumin is the active constituent, or the main active constituent in turmeric, the herb turmeric. So curcumin can help also. There's a number of other supplements out there. Green tea is a good one. Resveratrol is another one that can certainly help.
Now, do we see a lot of research supporting this with Parkinson's specifically, or do we make the clinical judgment based off, this protects this and this is what's happening, and so it's probably beneficial?
It's a little bit of both. No gold standard studies, but it's a little bit of both. In theory, these things can certainly help. They're not going to hurt. And then there's some indication, at least in animal models, that it really help.
Okay.
Yeah, I'm not going to jump to the place where, we have good gold standard studies on that. At least I'm not aware of any in humans.
Right. Right. But at the same time, this is what we do as clinicians.
Right.
You make that judgment call.
Right. And you're doing something that's not going to hurt.
Right.
It's not going to hurt the person.
Right.
And it can help. And there's so many other side benefits to a lot of these nutraceuticals that we just mentioned.
Yeah, absolutely.
So anyway, we just briefly talked about the biochemical pathway of dopamine, but it goes basically, think about your amino acids that can help. So sometimes using amino acids, supplementing with them, you can think about, well, why don't we try the precursors like phenylalanine and tyrosine, which go to L-dopa, which make dopamine. You know, and the B vitamins help catalyze those biochemical reactions, especially B6.
Okay.
And then one thing that people don't really know about, and it's part of my treatment with Parkinson's, is, you know, there are foods out there that actually contain L-dopa.
Oh, wow.
Actually contain it. And the one food that does out there are fava beans. So beans have small amounts of L-dopa. Fava beans have a little bit more, but there's actually something called the velvet bean, which you'll see in supplements. Like you see dopamine supplements around. Mm-hmm. Usually the velvet bean extract is in there. It's called Mucuna purins.
Huh.
And it has L-dopa. And I've used this quite a bit, and it helps. It does help people. So with Parkinson's, and I have clinical experience with that.
Yeah, wow. Seems like something you would definitely want to incorporate in your diet immediately, all these sorts of things. And the fava bean, I have never heard of that, Keoni.
Fava beans. Fava beans they're actually they're a very large bean. But fava beans I think they're delicious.
I can scoop that up at like Whole Foods or anything like that?
You can find it at Whole Foods. You can find fava beans, definitely.
How are you eating them?
Well, you can boil them. You can. I'm
sure you can eat them all types of ways. How are you eating them?
I'll make it like a fava bean mash.
Okay.
Yeah, and then do it. And sometimes I'll make a soup with them in there. You know, you can make them like a almost like a like a sauce out of them.
Yeah.
They'll break down pretty good. But you can find them. Go to any, health food store, or actually I would think most food stores would carry them too, but I know they're at Whole Foods.
I'll report back after I go grocery shopping.
Yeah. It's interesting though. God, what is that disease? Certain people cannot eat fava beans.
Wow.
Oh, it's a hereditary condition called glucose 6 dehydrogenase deficiency. And if you have that, you would know, because most people get tested for it. You would know at birth. But if you have that, you definitely don't want to eat fava beans. You'll get something called favism.
Wow.
And that's a life-threatening condition.
Oh, wow.
So in that case, fava beans can kill. So anyway, be careful with your fava beans. So what, as far as supplements go, we want to protect the neurons.
Right.
Pretty much. And there's a lot of supplements that can do that. And there are certain things that we can do that actually can enhance dopamine. One of them is exercise. One of them is a dopamine enhancing supplement, like taking velvet bean extract. There's a product out there called Dopatone. I think it's by Apex, which is, a pretty good product, which has that in there, but there's a number of them out there. And acetylcysteine is another thing that can help protect neurons and help you detox. Vitamin D. And these can all be done in conjunction with conventional treatment and will make the treatments work better.
Yeah, and there are all sorts of things like vitamin D I'm taking now. So there are all sorts of things you can be on or take supplementally.
Yeah. It's interesting. I haven't seen any studies on one of my other favorite spices, cocoa, but I haven't seen any other studies on cocoa. But I would think that cocoa would help too, because it does have dopamine-like chemicals in it. It has some neat brain effects. But
so eat your chocolate.
That's right. Eat your dark chocolate, greater than 70%. Yeah. What else should we go over with this?
Uh, Really, it's just for me, and the exercise aspect is really just goes back to those big principles. So it's, you want to be loud, you want to be big opening movements, really have them count the reps loudly. And that is really the principles of which we treat with, as far as like in physical therapy, of what they're going to do. And that'll help hopefully stave off some of those things that come on later, like we mentioned, where you continue to progress in a regressive way. And
Yep.
you find the depression and things like that. So really just big, open, loud movements, and continue to do those.
Well, and you're stressing the main treatment. I mean, that should be
Right.
the foundation of Parkinson's treatment is exercise. Because not only that, you're treating the actual problem, right?
Mm-hmm.
You're going to increase dopamine a little bit with exercise. You're helping the brain retrain itself so you can move more efficiently. And not only that, think about the mental emotional aspects of exercise.
Yeah.
You know? So it's an antidepressant. It's an anti-anxiety med. You know, the best out there. So exercise is huge, and it doesn't take a whole lot, but that's the baseline treatment right there. And then I second that. Then I would be like, all right, well, let's think about what are your exposures?
Yeah.
You know, and decrease any exposures that may be out there. Check your medication list. Let's make sure that's not a problem.
When you sit down with someone and take a history, Keoni, and you're looking at their exposures, you ask them about their occupation.
Mm-hmm.
You know, because obviously you can't just ask them, what are your exposures? So what type of questions do you ask?
I definitely ask about their occupation.
Mm-hmm.
So if I hear anything, oh, I'm a welder, or I work in a dye finishing plant, or I work in I don't know, like here, a lot of people work in the Haynes dye finishing plant. I work around volatile organic compounds like gasoline all the time, that type of thing. Or I'm a groundskeeper on a golf course. I spray, pesticides, herbicides a lot. A linesman for power lines. I just think about things like that because a lot of, around power lines, there's lots of spraying to keep the brush down, to keep those big towers free of that. So
That's interesting. I never even considered that.
Yeah. So anything like that, or if, somebody who's just out there spraying some pesticides or herbicides around their yard all the time. So just questions like that, and really making sure that their endogenous detox mechanisms are working appropriately.
Yeah. Which starts with exercise.
So they're pooping, peeing appropriately. They're getting enough sleep to restore their brain. They're not chronically stressed out. They are, they have social connections. They're not isolated, which this disease can certainly isolate people because they feel like they don't want to be around people because they have trouble eating or moving, that type of thing.
Yeah. That's where I think if you know someone and you can get them to one of those like boxing groups or something like that, I think that's huge. I mean,
I do too. Yeah.
See the faces on all of them while we were volunteering and stuff like that is true camaraderie. I mean, it's
right.
Yeah.
Yeah, definitely. I mean, that's the main thing. Fine. Exercise is huge. And I think, again, it goes back to, this is where I think a PT should be frontline treatment, like finding a physical therapist.
Yeah.
And that should be your main healthcare provider as you're going through this. And I'm hopeful. I mean, it's really interesting research coming on with Parkinson's, and then later on you get the dementia type illnesses. But for Parkinson's and other dementia type related illnesses, I think these things may be treatable to the point where we may be on the cusp of cures for a lot of this stuff.
Wow. And so what you've seen, and I know right now we're just speculating, but what is that? Is it a drug that automatically gives you all the dopamine you need? Is it somehow fixed?
Well, the best way I could say it is when cells don't work efficiently, they build up in trash, cellular trash. And with like dementia, you get things like, little clumps of cellular debris within the cells that kind of clog up the works.
Yeah.
And So with Parkinson's and dementia, you may see things called Lewy bodies. These are just protein, little clumps of proteins that just the cell cannot get rid of, and they just build up. It's analogous to a city where the sanitation workers don't come, and what happens? Eventually, the city doesn't work, because the streets aren't cleared, and trash is just building up in the homes and out on the street, and that's what's happening inside a cell. So, any medication, drug, supplement that can help clear that stuff out is gonna significantly help, or any type of medical device. I mean, I think I was reading something today where they're using some type of electromagnetic waves that help clean out the cellular debris in animal studies, and they're completely reversing some of these, neurological diseases because of that. And if you're talking about cellular trash, it's a really simple thing to talk about, but when you're not detoxing appropriately, right? You're building up cellular trash. Things aren't going to work as well. If you're not sleeping appropriately, you don't take out the garbage well. And think about how you function on not getting a lot of sleep,
Yeah, absolutely.
You're toxic in a sense, or your cells are more toxic. And as soon as you get a good night's sleep, you feel like a new person, you're taking out the trash, so to speak. So I think in general, that's how some of these drugs are gonna work.
So you definitely want to make sure they're getting good sleep then. So can you utilize melatonin and things like that?
Yeah, melatonin actually has some research showing that it may help with Parkinson's actually. If you have high amounts of inflammation in the body, that's another way to build up cellular trash, right?
Yep.
So anything that decreases inflammation in the body is going to help. Exercise certainly will do that over time. Curcumin's my favorite natural anti-inflammatory.
Yep.
And a lot of stuff we've already mentioned has anti-inflammatory effects, like the fish oil, green tea extract. All those will help.
Yeah. Anything
Just
else?
make sure you're not adding junk to the system. So if you're eating a crappy diet, that's certainly not going to help. So if it's a high sugary diet, yeah, I mean that's certainly we definitely see a strong correlation with that causing dementia.
Right.
I mean, that's why Alzheimer's in some circles is called like type 3 diabetes, because of, the amount of junk that people are taking in. Well, it can affect Parkinson's also. So just clean up your diet. If you work in some type of factory that has all these organic compounds or whatever, make sure you're wearing your gear, your protective gear.
So yeah, if someone does work there, protective gear, exercise, and all the kind of detox, quote unquote, mechanisms that we've mentioned, is there anything in particular for someone who's highly exposed to these sorts of things that you stress?
Well, the protective gear is the huge thing. It's a big thing. And I actually have a lot of factory workers that come in through my clinic, and it's like, it's almost like it's for some of them, it's very hard for them to wear stuff, like it's just, some of the equipment is just uncomfortable for them. Like, well, you need to find something that's going to work for you. It's a big deal. If there's a lot of particulate matter in the air, you need to have some type of respirator on that's going to take that out. If there's a lot of volatile organics in the air, you should have some type of respirator that filters that stuff out.
Right.
You're still going to be exposed, but you're going to significantly decrease the exposure. And then if you spray a lot of pesticides and herbicides, like for example, let's say you're you're a bug man, like a pesticide control, termite control person or whatever, you need to wear your protective gear. I can't tell you how many times I see some of those people just spraying the stuff
in their flip-flops.
I mean, yeah. Like that stuff is, it really needs to be heated, and, wear your protection.
Yeah.
And that goes for the same thing. So if you're in a home and you're getting your house sprayed for termites or whatever, you really need to heed the instructions and probably double it, what they're telling you to stay out of the house for 2 hours, or probably a day or so, open the windows.
Yeah. That's a good point. Yeah. The
so there's a lot of ways.
Always use protection.
Yeah, always use protection.
Absolutely.
That's right.
Sorry, Keoni, I didn't mean to cut you off.
Look, It's very true. Always use protection. Always use protection in all aspects of your life. What else? I think we covered everything I wanted to cover.
Yeah, me too. We covered it.
Okay. All right. Anyway, thanks for listening, everybody.
We'll talk with you next week.
Actually, Brian, before we get off, how do people get in touch with you on to get to your email list?
Absolutely. So there is a link in the show notes of bit.ly, and it's right beside my my website address. And if you click that, you can sign up for my weekly email list. And it's also in my Instagram page. You just click on my bio. Now, Keoni, where can people get to your?
I'm going to do the same thing that you have done, put it on my Instagram, but also right now it's pretty much sitting on my clinic website. So it's just go to
That's in the show notes.
Huh?
The nhnc.com, it's in the show notes. So you can click on there. Yep, whatever device you're listening to, if you go to the show notes, we have all the links for whether it's the guest who shares us their stuff or even our stuff. So we would love to keep in touch with you guys more.
Right, definitely. And hopefully soon we are actually going to get a Parkinson's expert on at some point.
Awesome. We look forward to talking with you guys next week.
All right, take care, everybody.